Good afternoon. The topic I'll be addressing is on Buddhism and healthcare and related issues. When you talk about Buddhism and healthcare, I have to take you back to the time of the Buddha, about 2,600 years ago. The Buddha himself lived to be 80 years old. That is higher than average American male, which died at the age of 75. Mahakashyapa, the first of the Chan tradition, contemporary to the time of the Buddha, he lived to be 100 years old. And Ananda, a personal attendant of the Buddha, supposedly lived to be 120 years old, the second in the Chan tradition, the supreme patriarch of that traditions. Buddha also was given a simile as a physician on the Four Noble Truths. Ayurveda, which is the ancient Indian medicine, must be truly advanced at that time for people to live that long. You may wonder when a lot of his disciples, sometimes in thousands, come to see the Buddha, like on the full moon of the third lunar month, about 2,600 years ago. 1,250 monks came unannounced to meet the Buddha. They are all the enlightened beings, ordained by himself. You wonder what happened to their health care, sanitation, illness, and preventive medicine when so many monks come together at one place. The Buddha must have known how the body and mind function very well to keep a preventive medicine for those monks. Basically, his preventive medicine also written down in the precepts that monks have to observe, 227 precepts for the male monk, 311 for female monks. The Buddha forbade monks to defecate or urinate or spit in the waterways. This is a picture of the current India nowadays that people still use, still defecate into the waterway, urinate and defecate in the waterway, which you know would lead to communicable disease, infectious disease of various kinds, such as you may have intestinal parasites, or pathologic E. coli, or maybe septicemia, infected cell there, or maybe bacteria, and giardiosis, give you diarrhea. And monks has to wash and clean themselves after defecation. He tells how to build and upkeep the restrooms and toilet seats that's been described in Tipitaka, which is the Buddhist canon, written or rehearsed at least 2,554 years ago. And monks has to overturn their utensil. This come to be a problem, like one of the forest monk with meditative tradition forgot to overturn the utensil after washing themselves, and the disciplinary monks saw that and asked question why he did not overturn the utensil against the precepts. So the answer was that he just forgot, but they did not stop there. Their students kind of scorned each other on that issue and create a lot of fighting amongst the two groups of monks. And the Buddha tried to stop the quarreling unsuccessfully. So he did try twice, and finally he left to live in the rainforest. And the elephant named Palalai brought him the sugar cane, and the monkey saw that, brought a honeycomb to give to the Buddha. And that became a Buddha statue in that gesture called Palalai gesture. After the monks quarreled for some time, they were starved because no one wanted to give them alms around anymore. Don't offer food to them, no alms offering. So after the rainy season retreat is over, they came to ask for forgiveness from the Buddha and asked him to return to town. In Buddhism, they also emphasize on and benefit on brushing their teeth, appear in the Tripitaka. And monks should finish eating 3 bites before feeling full. The reason you overturn your utensils so that the water won't gather there for the mosquitoes to lay their egg, which lead to malaria, because they're the vector for malaria. Buddha did take care of the sick. He personally took care of a sick monk lying in his urine and feces, setting an example for the monks' community. He advised them to take care of each other when one of them got sick, as if they were taking care of the Buddha himself. And that resulted in building wards for sick monks by ladies. King Asoka the Great, about 250 BCE, before Common Era, was to build hospitals not only for the public, but also for sick animals. And this served as the establishment of the first hospitals in the history of mankind. Buddha also advised in this following sutra that in youth there's aging, in health there's illness, in life there's death. Even though one may condemn aging, blaming aging for causing bad complexion, yet such beautiful body would still be aging. You cannot stop it. Even some may live to be 100 years old, yet no one can escape death. This is the Chara Sutra. Death will crush all lives without exception. When I sent this in the email to my friend who sent to a scientist friend, and he wrote back, how come the Buddha knew about apoptosis, programmed cell death? He's a genius. In youth there's aging, as you can see from an infant to a child, adolescence, young man, middle-aged man, old man, and die, like a different chapter of a book. Physical change may be easily recognizable, but mentally it's difficult to perceive as mind is formless. Mindful awareness could catch mind movement, it means the sneaky thoughts. And you can see that either physical or mental, body and mind, would follow the 3 universal characteristics of existence: arising, enduring, and ceasing as a norm. Show impermanence, imperfection, disease, suffering, not self or selfless in nature. In health there's illness. Like you walk through a park, you may not realize that you have faced a lot of enemies in the park. Like the pollens may hit you, make you sneeze. The dog may carry in parasites, spirochetes here, bacteria, worms, and so on. So it's a balance between the health and illness all the time. In fact, the immune system have the innate immune system and adaptive immune system. The innate, like the basic fighting system. We have like a lot of white cells and mast cells, macrophage, granulocytes, dendritic cells, and natural killer cells. Has innate immunity, and the adaptive immunity, like make antibodies, and the T cell and B cell work together to make antibodies to fight against the illness and bacteria and parasites and so on. In fact, there is up to 500,000 DNA modification each day, per cell per day. So it's a balance between, on the healthy cell, the rate of DNA damage equal to the rate of repair. In diseased cells, rate of DNA damage is overcome the rate of repair. Then you end up with cell damage. You may end up with cancer, senescence, apoptosis, programmed cell death. What happens if the immune system is going wrong, like in autoimmune lymphoproliferative disorder syndrome, LPS, defective in the fast-mediated T lymphocytes, apoptosis. So the cell never die, it keep growing in the lymphoid tissue, as you see here. A Canali-Smith syndrome is another name. ALPS, HLPS, the same disease. You can see that they have a lot of enlarged lymph node and also a lot of T cells, CD4, CD8 cells were abnormal, have autoantibodies and autoimmune disease and so on. In life there's death, like you see decaying as a natural phenomenon. Apoptosis, programmed cell death, a normal cell would have shrinkage with chromatin condensation, membrane blepping, nuclear collapse, continued blepping, apoptotic body formation, and lysis of apoptotic bodies. And there's some recycle of the material to build more new cells. And the pathway has been worked out as shown here. Apoptosis, programmed cell death. It's a norm of life. So important history of dental care. When you don't take care of your teeth well, what happens? You get periodontal disease. Like you see the plaque formation and the tartar, which stain your teeth like that. And it makes the bone resorb, cause the bone resorption, reducing the bone level. And the teeth that used to be healthy will be dead, even though it still look normal on the outside. Inside, the teeth is already decaying. That's the death of the teeth here. In China, 5,000 years ago, used urine to rinse toothache and bleeding gums. Hippocrates cleaned teeth with a bowl moistened in the honey. And Galen, anatomists, used to rub their gums with brain over hair. And toothbrush appeared in Europe, first in France in the late Middle Age. But when you come to Tripitaka, there's some citing already that the Buddha used toothbrush of three sizes, large, medium, and small, even though they did not describe the nature of it, but still being passed on and used in Thailand. It's made of the neem plant, the twig of the neem tree, and they power it on one side and probe it and thin to the other side as a probe. They thin it out as a probe for picking your teeth. It's toothpick on one end, the brush on the other. So there's a description in the Tripitaka, Buddhist canon, with the first rehearsal 2,600 years ago. There's 5 dangers of not chewing toothbrush. Got blurred vision, because in chewing the neem plant, the twigs, you may have got some vitamin A and so on, or some other chemicals. Bath mouth odor, taste bud not clean, phlegm covering food, and food does not taste good. So there are 5 benefits too from the toothbrush chewing. One is clear vision. We may get some chemical vitamin A from that. No bad mouth odor. Clean taste bud, no phlegm covering food, and food tastes good. This appears in the Toothbrush Sutra, Denta Katha Sutra. So this is the neem tree, or sadao in Thai, as a director indica. It made the news, Good Morning America, about 15, 20 years ago. Even though this is an ancient plant in Buddhist Chadok, Buddhist Jakarta. Tales mention that it's a nature's bitter boon, highlighting mankind's interdependence on natural environment and restoration ecological balance on Mother Earth. This most researched tree, because it made Good Morning America because it said this plant doesn't have any insects on it at all. And it turned out it made